It's a common and unsettling question. What should you do if you experience a heart attack while completely alone? This scenario is, unfortunately, far more common than many realize. People often mistakenly believe they'll have ample time to react or that someone will always be nearby to help. However, the truth is that the first few minutes are critical, and the actions you take or fail to take can determine the outcome. The good news is that even if you live alone or spend most of your time in solitude, it is still possible to survive a heart attack, provided your actions are swift and precise. This guide will outline 7 crucial steps to take the moment heart attack symptoms begin when you are without assistance. These actions are simple, practical, and can save your life. They don't require special medical training or complex equipment. All that's needed is preparedness and the ability to remain calm. We will thoroughly examine each step, from recognizing the earliest signs and immediate measures to preventing excessive strain on your heart, and taking small actions that can buy precious time for professional help. Don't wait until it's too late to understand what your body is signaling. Let's explore these vital recommendations. First and foremost, recognize the earliest warning signs. The foundational step to surviving a heart attack when alone is to deeply understand how this condition truly manifests. This isn't just about chest discomfort. It involves symptoms affecting the entire body. Most people, influenced by cinematic portrayals, expect severe, crushing chest pain. However, real heart attacks often begin with far more subtle indicators. These early signals are easy to ignore, which can lead to irreversible consequences. Pay close attention to a deep, unpleasant pressure or a squeezing sensation in the center of your chest. It might feel like something heavy is pressing on your chest, or as if it's slowly filling with cement. Notably, these sensations can come and go, misleading you into thinking nothing serious is happening. But if this feeling lasts for more than a few minutes or consistently returns, dismiss any doubts. Other early signs include shortness of breath, which can occur even without accompanying chest pain. You might feel as though you've just climbed a steep hill, even when at rest. Some people experience pain radiating into an arm, shoulder, neck, or jaw. Others may notice dizziness, a cold sweat, nausea, and general weakness. In certain cases, especially among older adults or women, the pain might feel more like pressure in the back or abdomen rather than typical chest discomfort. Consider Richard, 74, who was sitting at his kitchen table when he suddenly felt a strange tightness below his collarbone, similar to heartburn. Soon, he noticed he couldn't take a full breath, and his palms began to sweat. Richard recalled reading that not all heart attacks involve sharp pain. So, instead of dismissing these symptoms, he immediately took action. This decision very likely saved his life. Your body often gives subtle cues before escalating to a cry for help. When it comes to heart attacks, these whispers are your only chance to act before irreversible damage begins. Waiting for the classic dramatic scene of clutching your chest can lead to a fatal delay. Therefore, the next time something feels off, especially if it's a combination of pressure, shortness of breath, or unusual fatigue, immediately stop all activity. Do not try to tough out the discomfort. Do not convince yourself it's just indigestion. Recognizing these warning signs is your first and most crucial chance for survival. Take them seriously, even if they seem minor. Your life may depend on it. Second, immediately call 911. The moment you suspect a heart attack is beginning, the very next action you must take, without the slightest hesitation, is to call 911. Do not wait for symptoms to disappear on their own. Do not attempt to drive yourself to a medical facility, and certainly do not think you are overstating the seriousness of your condition. Calling emergency services is not only the fastest way to get professional help, but also the most effective life-saving action. A heart attack is not something you can simply ignore or postpone. Every minute is critical. The longer your heart muscle is deprived of oxygen, the more extensive the damage becomes. When you call emergency services, trained professionals begin preparing for dispatch even before they arrive on scene. They are equipped with necessary tools and medications, and could sustain you if your heart stops on the way to the hospital. Moreover, if your symptoms rapidly worsen, which often happens, you might become unable to help yourself. This is why attempting to drive yourself to the hospital is one of the most dangerous decisions people make. They're at a risk of losing consciousness, potentially leading to a car accident or significantly delaying vital care. Let the professionals come to you. Consider Linda, 78. She felt an unusual pain in her left shoulder, followed by nausea and a cold sweat. Her first thought was to call her son, but then she remembered a nurse's advice. If you're alone and might be having a heart attack, call 911 first. Talk to family later. She followed that advice. By the time paramedics arrived, her symptoms had intensified, but they were fully prepared and stabilized her on the spot. That phone call undoubtedly saved her life. You don't need to be absolutely certain you're having a heart attack to call for help. The dispatcher won't be upset if it turns out to be something else. On the contrary, they'd rather send help that isn't ultimately needed than miss a chance to save a life. It's recommended to keep your phone easily accessible, especially if you live alone. If symptoms escalate and it becomes difficult to speak clearly, use the emergency call feature. Some phone models have a dedicated button or shortcut to call for help even when locked. It's important to know where this feature is in advance and be ready to use it. Second, crucial: slowly and calmly chew aspirin. After calling emergency services, the next most effective and simple step is to chew aspirin. It's vital to chew the tablet, not swallow it whole. Do this slowly, even if your hands are trembling. If you have access to standard 325 milligrams aspirin and have no allergies or contraindications related to blood thinners, this single action can significantly increase your chances of survival during a heart attack. Aspirin has blood-thinning properties. It helps slow or prevent the growth of a blood clot that can block one of the coronary arteries, which is the primary cause of a heart attack. Chewing the tablet instead of swallowing ensures the active ingredient enters your system more quickly. Studies have shown this can buy valuable minutes, sometimes even enough to partially restore blood flow before medical help arrives. It's important to note that taking aspirin on an empty stomach is generally not recommended unless absolutely necessary. However, in the event of a heart attack, the risk of clot formation far outweighs this precaution. Also, do not take enteric-coated or extended-release aspirin. If that's all you have, you should still chew it. The effect needs to begin as quickly as possible. Consider Joe, 72. One morning, he felt a tightness spreading from his chest to his neck. He remembered he had a bottle of aspirin in his kitchen cabinet. He chewed one tablet while sitting and waiting for paramedics. Later, his cardiologist told him that this single action likely reduced the damage to his heart muscle. This small pill, according to the doctor, prevented the situation from worsening. If you live alone, ensure aspirin is easily accessible. Keep it on your nightstand, in a kitchen drawer, or even in your wallet. It's crucial to check the medication's expiration date and inform loved ones where it's stored, in case they ever need to assist you. This seemingly simple act is based on scientific data and is actively used by emergency services worldwide. Chewing aspirin at the onset of a heart attack is not just advice. It's a proven medical intervention. In those critical first minutes, it can be the deciding factor between being discharged from the hospital and not making it there at all. Third, crucial: sit or lie down to protect your heart. After calling for help and taking aspirin, the next task is simple yet absolutely critical. You must cease all movement. Sit or lie down in the safest and most comfortable position possible. Now is not the time to pace, gather belongings, or open doors unless absolutely necessary. Any additional physical exertion places excessive strain on your heart, which is already struggling to get enough oxygen. Ideally, sit with your back supported, feet flat, and arms resting freely. This position helps minimize the workload on your heart muscle while you await paramedics. If you feel faint or dizzy, it's recommended to lie on your side, with your head slightly elevated. It is extremely important not to try to ignore or push through the discomfort. While that mindset might have served you well in other life situations, at this critical moment, it poses an unacceptable risk. People often feel awkward after calling emergency services and then remaining inactive. But understand this clearly. Inaction in this context is, in itself, an active measure. It gives your heart a chance to stabilize, helps slow your breathing, and prevents the rapid depletion of your body's already limited oxygen supply. Consider Alice, 81. When she felt a crushing sensation spreading across her chest, her first instinct was to tidy her kitchen and pull herself together. However, she remembered her doctor's words, "If you suspect heart trouble, sit down. Everything else can wait." She sank into her favorite armchair and patiently awaited help. This conscious stillness, as she later learned, likely prevented her symptoms from escalating to full cardiac arrest. So, if you ever feel these symptoms approaching, pressure, shortness of breath, dizziness, do not try to finish what you're doing. Stop immediately where you are, or move with minimal effort to a safer spot. Sit or lie still, breathe slowly, and allow your body to focus solely on one task: survival. And one more simple, often overlooked aspect: if you're sitting in a chair without armrests, don't slouch. Keep your back straight and your breathing free and deep. The more relaxed and upright your posture, the less effort your heart will have to exert to do its job. If you still have sufficient strength after calling for help and getting into a comfortable position, one of the most advisable actions is to open your front door. This step might seem minor, but in an emergency, every second is crucial, and a locked door can significantly delay assistance when time is literally of the essence. While paramedics are trained to force entry if necessary, this method wastes precious time, can damage property, and might even startle or injure you if you're near the entrance. Opening the door beforehand allows them to enter unimpeded and immediately begin providing aid. This simple act can save several minutes your heart, in a state of crisis, simply might not have. If you live alone, especially in an apartment or gated community, it's wise to consider all logistical aspects before a crisis strikes. Does your door open easily from the inside? Is your address number clearly visible? Do you have a spare key accessible to a trusted contact? These points don't seem urgent until they suddenly become so. Consider Paul, 76, who lives in a small apartment. When his symptoms began, he called 911, chewed aspirin, and opened his door, all in less than 2 minutes. Paramedics later noted that this action allowed them to reach him 30 seconds faster and avoided the need to break down his door. "It was the last thing I would have thought of," he later said, "but it probably helped me get help in time." However, if getting to the door feels too risky or causes excessive strain, do not do it. It's better to remain still and focus on your breathing. But if you're close to the door and feel stable enough to reach it safely, open it. You might also consider installing a smart lock with remote access or a medical key safe, especially if you live alone or have limited mobility. This is a small but important act of preparation that sends a clear signal to those coming to rescue you. You are ready. You've done your part. Now it's their turn to do the rest. When you're alone and awaiting help during a heart attack, your phone transforms from a mere communication device into a true lifeline. One of the most sensible ways to use it at such a critical moment is to activate the speakerphone. This allows you to converse with emergency services without holding the phone, enabling you to focus on steady breathing and maintain maximum calm, avoiding the need to grip the phone tightly or press it to your ear. In a state of stress, even simply holding an object to your ear can exacerbate labored breathing. Using speakerphone not only reduces physical strain, but also ensures the dispatcher can hear you better if you suddenly become too weak to speak clearly. Furthermore, it allows the dispatcher to pick up on background cues about your condition, your breathing pattern, movements, even your voice's intonation. Beyond this, every modern smartphone is equipped with another extremely important feature: an emergency medical ID. On iPhones, it's accessible even from the lock screen. Android phones often have a similar function. It contains vital information such as your age, allergies, list of medications, and medical conditions. If you become unconscious by the time paramedics arrive, this data can significantly save time and help medical professionals make informed decisions about your treatment. Consider Susan, 79. She lost consciousness moments before help arrived. However, because her phone's medical ID was set up, paramedics immediately knew she had diabetes and was allergic to penicillin. This prevented them from administering substances that could have worsened her condition. They were also able to contact her daughter using the emergency contact listed directly on the phone. Setting up this information takes less than 5 minutes and remains permanently stored. It's recommended to include your name, date of birth, any major medical conditions, a list of medications, allergy information, and 1 or 2 emergency contacts. This feature isn't just for the tech-savvy. It's useful for anyone who might one day need help when they can't speak for themselves. Therefore, if you ever feel the first signs of an impending heart attack, use speakerphone. It's crucial to stay connected and trust the person on the other end of the line. Their calm voice, clear instructions, and constant presence can make the wait less frightening. And if something happens before help arrives, your phone can still speak for you when you no longer can. In the throes of a heart attack, it's easy to succumb to panic. Your chest tightens, thoughts race, and every second feels louder than the last. However, you have one final tool: your breath. Used correctly, it can calm your nervous system enough to give your heart a better chance of remaining stable. Controlled breathing doesn't cure a heart attack. What it does is help your body avoid going into full shock while help is on the way. The greater your anxiety, the faster your heart might beat. But slowing your breathing can gently guide that rhythm back towards normal. No special technique is required. Simply try this. Slowly inhale through your nose for about 4 seconds. Hold your breath for a moment. Then slowly exhale through your mouth for 6 seconds. Repeat this cycle. Focus on this one small rhythm. It gives your body something stable to anchor to and can help prevent your heart from spiraling into dangerous, stress-induced arrhythmias. Recall what happened to Frank, 83. When the pain hit him, he felt like he was drowning in fear. But he remembered a simple breathing exercise his doctor had taught him during a checkup. He focused on each breath, stayed still, and let the panic go. By the time paramedics arrived, his heart was still unstable, but not in full arrest. I just kept thinking, stay calm. Stay alive, he later said. You can practice this breathing anytime. When you're relaxing, feeling anxious, even watching TV. The more familiar it becomes, the more instinctively your body will revert to it when the stakes are high. Breathing won't fix your arteries, but it can buy you time. It can keep oxygen flowing and help your heart hold on. And sometimes, in those final moments before help arrives, that's the only edge you need. Stay still. Stay alive. Ultimately, surviving a heart attack alone isn't just about luck. It's the result of preparation, awareness, and calm, purposeful action. These 7 steps may seem simple individually, but together they form a powerful chain capable of saving your life. You should recognize the warning signs. Immediately call for help. Take aspirin if possible. Sit or lie down to conserve energy. Facilitate access for arriving assistance. Wisely use your phone's tools and slow your breathing to keep your heart stable. Each of these measures gives you a little more time. Each give you a little more control. And each says something important. Even when you are alone, you are not powerless. Heart attacks can feel like the most terrifying kind of solitude. But these steps remind you that you are not helpless. Not for a second. You have the tools. You have the knowledge. And now you have a plan. So, ask yourself what resonated most today. Was there a step you hadn't considered before? Or one that now seems different? It's important to think about how you can apply this to your life and perhaps even share it with someone you care about. It might save not only your life, but also the lives of your loved ones.